Hello, everybody. This is Sharon, and I have a message for people who have diabetes. And my message is going to be short, but I will be giving the message today. And I also plan to give 30 days worth of messages or information about diabetes. So for the next 30 days, I'm going to be coming to you with information about diabetes that could be helpful to people who have diabetes and also helpful to those people who may know someone who have diabetes. So that's what we're going to be talking about today. And it's going to be short, so I won't be here long. Hello, people. How are you? Farron and Sophia, how are you? Thank you for joining me. So we are talking about diabetes today. For those who don't know, I am a registered nurse, and I've been a registered nurse for over 36 years. I've worked in the medical field for over 38 years, helping people with diabetes. But I also have my own experience with diabetes where I had to get serious about the diabetes that I'd had for over 10 years. I'd had diabetes, and I had to actually get serious because I was coming across a lot of things that were happening to me that could cause complications in my life. So, diabetes, for those who don't know, it is a serious disease. It's not really an epidemic, but it's really close to being an epidemic here in the United States. There's over 30 million people in the United States have diabetes. And so today, what I want to talk about, I did write a book. I will shamelessly plug my book, but I did write a book about my experience with diabetes, and it's called Your Doctor is Not the Boss of You. And it's not a doctor bashing book, but what it is a book where I tell my testimony of how I had to go against the regular routine treatments that they recommend to treat diabetes or manage diabetes, because I was tired of managing my diabetes. I was ready to heal my diabetes, okay? I was ready for it to be gone. So that is why I wrote this book. I did go from having 4 insulin shots a day to no insulin shots, and all that is in the book. But today I wanted to talk about some of the complications that if you are diabetic and you continue to go the regular way of treating or managing your diabetes, I want to talk about some of the complications that you can get when you have diabetes for a long time. So welcome, everybody. Welcome, William. Let's see who else joined me. Keith, Alice, Denise. Hi, Denise, and Cynthia, and Sherry, and Anthony. Oh, wow. Thank you. Thank you, everybody, for joining me. So today, yes, for those who maybe saw that I was talking about diabetes, I am talking about diabetes today, and specifically about the complications that you can get with diabetes. And there are 9 major complications that diabetics can get, especially if you had diabetes for a long period of time. These are some of the things that you can have complications related to. Oh, someone said that I had a great book. Thank you. This is the book that it is on Amazon. It's Your Doctor is Not the Boss of You. And I wanted to highlight diabetes for the next 30 days. So I will be giving information about diabetes, some things to help people who have diabetes, or maybe if you have family members that have diabetes, something that I will share, I am sure, that can help them in their journey of healing for diabetes. So the 9 complications that I want to talk about today is cardiovascular disease. After having diabetes for a long time, you can start having heart issues. You're more prone for heart attacks. You can have high blood pressure. Okay, so those are some 3 major things that you can get related to the heart. Also, a complication is that you can have nerve damage, and they call that neuropathy. Okay, they call that neuropathy, where you have tingling or numbness in your extremities, like your fingers or your toes or your feet. So that is kind of a common thing that you'll see in people who have had diabetes for a long time. You also will see kidney damage. Many times people with diabetes for long-term diabetics end up on kidney dialysis and different things like that. You also can get eye damage. Now, with eye damage, we see a lot of people have cataracts. They actually have retinopathy, a lot of complications where their vision is affected when they have diabetes. So that's number 4. And number 5, they can have foot damage. Where you go, I'm gonna go back again where we were talking about the neuropathy. If you have nerve damage and your feet is pretty much affected because the circulation is not there, the nerves are not as acute as they usually are, and sometimes things can happen to our feet, and because it's the furthest from our heart, it's hard to heal anything that happens to your feet. So that's why it's a very good idea for people who have diabetes to check their feet often. Okay, very, very often. Don't go barefoot. Be careful. Actually, my great grandmother was a diabetic, and she lost both of her legs. Not at one time, but because of the diabetes, the foot complications she did have, and she ended up losing both of her legs. And she died of other diabetic complications at the age of 83. She did live a long time. Okay, but the complication potential is there. You also, as a diabetic long term, you can have skin conditions. You can get bacterial infections, fungal infections on your skin, particularly in your feet and places like that. That is very, very hard to get rid of. You can also have hearing impairment. So as a diabetic, your hearing can be affected, acutely affected. You can also have Alzheimer's disease, and that's because the brain is not getting as much good circulation, and there's so much sugar or glucose in the blood that it affects your brain as well, so the nervous system. So that's why many diabetes also have Alzheimer's disease. And then the last thing I want to talk about, which would be number 9, and that is depression. So many diabetics who have been a diabetic for a long time, they can be depressed. Okay, even if they've had it for a short period of time, many diabetics have symptoms of depression because it is a disease that the doctor tells you that you're going to have it for the rest of your life. So they're sitting there thinking that I'm going to have this forever. They're not happy about it. They're sad about it. So depression sets in pretty quickly and can stay there if left untreated. So those are the 9 complications that are related to being diabetic. But so the longer that you have diabetes, the higher your risk is of having the complications. And eventually the diabetic complications can be disabling to people, and it also can be life-threatening. So if you have diabetes, or you know someone who have diabetes and you don't want these outcomes, that's what I call them, they're outcomes, and there is a potential to have these complications is high if you've had the diabetes for a long period of time. And so what my mission is, and what my passion is right now, is to help people who are in these situations where they've been on insulin shots for a long period of time. It is my goal to help people get off insulin. Now, I've done it for myself, and I am willing and able to help anybody who wants to be helped to get off insulin shots, because it is a pain to be on insulin shots. It definitely is. And as if you did not come on earlier, you may not know that I had a period where I was on 4 insulin shots per day, and it was not fun. It altered my whole lifestyle. So I know that is not fun. So if you're on insulin shots and you're ready to get off of them, I have a class that I have developed. And the class is called Healing Diabetes 101. Healing Diabetes 101. And if you want to know more information about the class that I will be facilitating, you can contact me by email. Email me at SharonFant01 at gmail.com, and I will put it in the chat. Someone wrote a note, 10 things you can eat or drink. Oh, that's a good topic. I will do that. with my next video, okay? So 10 things you can eat or drink. Well, there's a lot more than 10 things that you can eat or drink as a diabetic, but I will name some of the top 10 things that are the best to eat or drink. Okay, so that's what I'll do. I can do that tomorrow. Okay, and I'm going to probably come on again tomorrow about the same time, 8:15, somewhere like that, with additional information about diabetes, because I am determined to to help people who are diabetics. So again, if you want to be a part of the healing group that I'm forming, Healing Diabetes 101, you can contact me at SharonFant01@gmail.com. All right, Farron, I'm going to make a note of that to talk about 10 things that you can eat or drink as a diabetic. The best things, okay? All right, so very good. So if anybody else have any questions before I end this video, because I was going to make it short, I didn't want to make it long. And I thank everybody for being here. Micah, Curtis, Antonio. I'm sure I'm saying people's names wrong, but that's okay, right? Oh, and Brian, how are you, Brian? So thanks everybody for watching. I will be doing a video about diabetes because it's something that people are aware of, but they don't know enough about. So even for people who have diabetes, more awareness and education around diabetes and what happens for people who have diabetes will, I think, improve people's outcomes, improve people's condition. So that is my goal, to help people who have diabetes. So we will start again tomorrow about between 8 and 8:30. And thank you all for watching. Hi, Eloise. Thank you all for watching. I appreciate it, because I know you could be doing something else. But I really thank you for joining in. And if you will share this video on your timeline, hit the like button, and so for people who may be on your timeline that may want to hear the information that I shared today about the complications related to diabetes. Now, some of these complications people probably know, and some that they did not know at all, that people with diabetes can get. All right. So thank you. See you tomorrow. We will talk again then. Take care, everybody. Bye-bye.